Hi, how are you? I know you're feeling really worried after you saw those genetic results from your genetic test. So let's talk about it a little bit. I'm here to help you feel better. So it looks like your report says that you're predisposed to type 2 diabetes. First thing is first, take a huge deep breath. Being predisposed does not mean you're going to automatically develop diabetes. Let me explain this in some simpler terms for you. So predisposition, that simply means that your genes might make you a bit more likely to get diabetes compared to someone else who does not have those specific genes. Think of it as your body's way of saying, hey, just pay a little more extra attention in this area. According to experts, genetics is only one part of the equation. There are many other things you can control that can keep you from developing type 2 diabetes. Lifestyle is going to play an even bigger role than your genetics. Things like what you're eating, how much you're out there exercising and moving your body, your stress levels, and maintaining a healthy weight are all going to significantly impact your risk of developing diabetes. The Centers for Disease Control and Prevention actually emphasize that regular physical activity, balanced nutrition, and managing your weight are going to effectively, dramatically lower your risk, even if you have a genetic predisposition like you do. So you mentioned you don't eat many sugary foods, which is actually really awesome. And you probably want to stay away from carbs also. And it's also helpful to actually consider some other healthy habits. So what can you do from here? First, keep up the good work. You're doing awesome and you're paying attention to most of the right things. Add more fiber-rich foods maybe. What about some healthy fats and some lean proteins to your meals? Also stay active. Even just some of the regular walks and little workouts that you do are helpful. Those can make a really big difference. So another big important part of the puzzle is going to be staying in touch with your healthcare provider. They're going to help you monitor important indicators like your blood sugar levels that can detect early manifestations of diabetes type 2. Remember, even though you have this genetic insight, it is really empowering. It allows you to take charge of your health proactively and start focusing on the things that are going to help your body not develop type 2 diabetes. Your genes are not going to dictate your future. They simply just help guide some of your decisions that you're making when it comes to keeping yourself healthy. So you're really doing all of the great things, and I'm here to help you stay healthy every step of the way. You have me and you have your healthcare provider. We can all help you live a healthy lifestyle and not develop type 2 diabetes, even with your genetic predisposition.